Well, I wanna make love to you tonight. I can't wait till the morning has come. And I know that the time is just right, and straight into my arms you will run. And when you come, my heart will be waiting to make sure that you're never alone. There and then all my dreams will come true, dear. There and then I will make you my own. Anytime I touch you, you just tremble inside, and I know how much you want me that you can't hide. Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my love? Well, I wanna make love to you tonight. I can't wait till the morning has come. And I know that the time is just right, and straight into my arms you will run. And when you come, my heart will be waiting to make sure that you're never alone. There and then all my dreams will come true, dear. There and then I will make you my own. Anytime I touch you, you just tremble inside, and I know how much you want me that you can't hide. Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my love? Can I just have one more moon dance with you, my love? Can I just make some more romance with you, my I just want one more moon dance with you. Yes, I do. Needed the shelter of someone's arms, and there you were. Needed someone to understand my ups and downs, and there you were. With sweet love and devotion, touching my emotions, I wanna stop and thank you, baby. I just wanna stop and thank you, baby. Oh, oh yeah, how sweet it is to be loved by you. How sweet it is to be loved by you. I close my eyes at night, wondering where would I be without you in my life. Everything I did was such a bore. Everywhere I went, you know I've been there before. But you brighten up for me all of my days, with a love so sweet in so many ways. I wanna stop and thank you, baby. I just wanna stop and thank you, baby. Oh, oh, how sweet it is to be loved by you. How sweet it is to be loved by you. To me then I was For me there is you and there ain't nobody else. I wanna stop and thank you, baby. I just wanna stop and thank you, baby. Oh, how sweet it is to be loved by you. How sweet it is to be loved by you. I mean, it's like California, don't you know, to be loved by you. How sweet it is to be loved by you. How sweet it is to be loved by you.
I've got sunshine on a cloudy day. When it's cold outside, I've got the month of May. I guess you say, what can make me feel this way? My girl, my girl, my girl, talking about my girl, my girl. I've got so much honey, the bees envy me. I've got a sweeter song than the birds in the trees. Well, I guess you say, what can make me feel this way? My girl, my girl, my girl, talking about my girl, my girl. Hey, hey, hey. Hey, hey, hey. Yeah, I don't need no money or champagne. I got all the riches, baby, one man can claim. Well, I guess you say, what can make me feel this way? My girl, my girl, talking about my girl, my girl. I've got sunshine on a cloudy day with my girl. I've even got the month of May with my girl. Talking about, talking about, talking about my girl. Ooh, my girl.
Ladies and gentlemen, please welcome to the stage our 2017 Duke University Health System Friends of Nursing Excellence Award winners.
Take it in, but don't look down.
'Cause I'm on top of the world, eh? I'm on top of the world, eh? Waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, eh? But holding it for a while, eh? Take you with me if I can. The gym and the dance. Get up now, get up, get up now. 'Cause I'm on top of the world, eh? I'm on top of the world, eh? Waiting on this for a while now. Paying my dues to the dirt.
Good evening, and welcome to the 29th Annual Friends of Nursing Gala. I'm Mary Ann Fuchs, and I serve as the Vice President of Patient Care and System Chief Nurse Executive for Duke University Health System and Associate Dean of Clinical Affairs for the Duke University School of Nursing. And I'm delighted to be your host on this special occasion. We have gathered together to celebrate nursing excellence at Duke, and we have much to celebrate. The fact that we even have a gala celebration of nursing excellence is remarkable in and of itself. Very few health care organizations have endowed programs that support nursing. We are quite fortunate. And this evening, we remain grateful to Martha White Blaylock and Dan S. Blaylock Jr. for envisioning Friends of Nursing, and especially to Dan, who made their dream a reality. Martha was a patient at Duke University Hospital, and following her death in 1988, Dan founded Friends of Nursing and became its primary benefactor. The first gala was held in May of 1989. The highlight of our evening will be the individual recognition here at Center Stage of the 36 nurses who have been selected to receive the 2017 Excellence Awards. At this time, we have a few greetings for the occasion, and we are so pleased that Dr. Jean Washington, Duke's Chancellor for Health Affairs and the President and Chief Executive Officer of our health system, is here with us, and I invite him now to offer his welcome.
Thank you, Mary Ann. Wow, you are beautiful. I wish that you could see yourselves. This is truly an auspicious occasion, and I am delighted to be here with you to celebrate. And we have so much to celebrate. This evening is appropriately entitled A Celebration of Excellence. And it's my understanding that this is the 25th annual celebration for this occasion. When I look around the room, I see groundbreaking frontline nurse practitioners. I see seminal researchers, and I see gifted educators. You in this room embody the excellence that we want across all of Duke Health, and particularly in the Duke University Health System. And so I want to congratulate everyone in the room. I want to particularly congratulate our honorees. It's quite an honor for you to be recognized here this evening, but it's also an honor for us to be able to hold you up as an exemplar of what we stand for in Duke University Health System. There are so many awards that we've received that serve as testament to the excellence that we bring to the organization and that you bring as individuals on a day-to-day basis. Just recently, Mary Ann Fuchs, our Chief of Nursing, and Dean Broom, Dean of the Nursing School, accepted the International Sigma Theta Tau Academic Practice Partnership Award on behalf of our Duke Advancement of Nursing Center of Excellence. Wow, what a recognition, and what a well-deserved. So in addition to welcoming you and congratulating you, I want to thank you. You bring great distinction to our institution. Importantly, from day to day, you come to work, take that extra step, drawing on your passion and your commitment to providing the highest quality patient-centered care known to anywhere in the known universe. It doesn't get any better than that. You come to work every day taking care of not just our patients, but their families and their other loved ones. And you come to work every day, importantly, taking care of each other. These awards, which bespeak of our commitment to continued development and education, are just one example of how we work to take care of each other. And in taking care of each other, we build a healthy community. And in building that healthy community, it allows each individual to thrive and achieve his or her best. So importantly, besides what you do on a day-to-day for our patients and their families, we appreciate what you do in terms of contributing to the current health of our community, but also the foundation that you lay as we look to the future. And as I've often been quoted as saying, believe me, because of you, the best is yet to come. Again, congratulations and thank you.
Thank you so much, Dr. Washington. I would also like to especially thank tonight Dr. Bill Fulkerson, who serves as the Executive Vice President of Duke University Health System, Rhonda Brandon, our Chief Human Resources Officer for Duke Health, and hospital presidents Katie Galbraith and Dave Zoss for attending tonight to celebrate and recognize all of our staff. Welcome to all of you. We also have a greeting from the Board of Advisors for Friends of Nursing, and Mary Ann Peter will offer that greeting. Mary Ann is a co-chair of the board, along with Dan S. Blaylock, Jr. Dan and his wife, Patty, regret that they could not be with us this evening, but sent along many good wishes for a grand evening.
I'm so happy to welcome you tonight on behalf of the Friends of Nursing Advisory Board and the founder of Friends of Nursing and benefactor, our friend Dan Blaylock. Dan began Friends of Nursing in 1989 when he asked the question, if nurses had some money, what would they do with it? Of course, we had no idea what the answer would be, but we knew who to ask. A cadre of nurses representing all Duke nurses came together, and the result was the launch of what we celebrate tonight, a program that honors nurses and encourages their professional growth. At the first gala in 1989, we paid tribute to 4 nurses with Excellence Awards and gave 4 stipends for nurses to present at conferences. Look how far we have come in 29 years with the help of Dan and many other grateful individuals and corporations. You may be aware that this program is the only one of its kind in the United States, just as Dan Blaylock is one of a kind, who despite the despair of his wife's illness, had the foresight and the vision to think of what he could do for nurses. I'm sorry to say that Dan is very ill himself at this time in Florida, but I am sure his spirit and wishes will be sustained through Friends of Nursing as we go forward. It's quite a legacy you are fulfilling. Dan would be humble as well as proud. Congratulations to the nurses who are the 2017 Friends of Nursing Excellence Award winners. You are role models for all of us. And congratulations to all Duke nurses for their positive professional impact you have on patients, their families, and your colleagues. We hope that all of you will have a wonderful celebration tonight.
Thank you, Mary Ann, for your leadership and dedication to nursing excellence. The Board of Advisors is the backbone of Friends of Nursing. The men and women have served on the board over the past 29 years and have provided guidance, expertise, and financial support to ensure that Friends of Nursing will support Duke Nursing forever. So would the members of the board please stand as I call your name? Mary Ann Peter, Nancy Anderson, Allison Breisch, Ted Cole, Sharon Dooley, Pam Edwards, David Kong, Fran Mooney, Bragg McLeod, Brenda Nevijan, Kevin Sowers, Ellen Tim, Mary Vinson, Dottie Williams, Emeritus Member Mary Champagne, and ex officio members Marion Broom, Tracy Goslin, Vicki Ordo, Priscilla Ramser, myself, and our committee chairs, Jana Alexander, Helen Horiuchi, Gila Mostagimi, and Fred Sullivan. So please join me in thanking the Board of Advisors. Dozens of nurses actively volunteer their time to support Friends of Nursing in serving on 4 committees that ensure the vitality of the program today and into the future. So if, the nurses who serve on the Publicity Committee, Awards and Stipends Committee, Martha White Blaylock Nurse Scholars Committee, and Gala Committee, would you please stand so that we can thank you? I would also like to recognize colleagues from the schools of nursing associated within our health system. Dean Marion Broom from the Duke University School of Nursing regrets that she could not be here. Many Doosan graduates join our health system each year, and many of our nurses seek advanced degrees from the Duke School of Nursing. And would Dr. Peggy Walters please stand? Peggy is the Director of Nursing Education at the Watts School of Nursing and Director of Hospital Education at Duke Regional Hospital. Watts has been educating nurses since 1895, and we are proud that many Watts graduates choose to practice at Duke Health. So thank you to both Marion and Peggy for their roles in shaping the future of nursing. And I greatly appreciate the volunteers from both schools who are helping out with this event, primarily as ushers. And we have many volunteers tonight, and I would also say I would like to thank Jana Alexander, who is the program director for Friends of Nursing. She's here somewhere in the room, I hope. Let's give her a round of applause for this event tonight. There she is in the back. I also would call your attention to the list of contributors on page 3 of your souvenir program. Friends of Nursing would not be the vibrant and robust program today without ongoing financial support. The list includes the names of those making annual gifts, as well as a number of nurses who contribute through payroll deduction. Each gift counts, and I am grateful to each of these donors for remembering Friends of Nursing in their charitable giving. The program is also supported by advertising. Thank you to the 30 organizations that placed ads in this year's program. The ads begin on page 31, and so if you would, please take time to read the sentiments that are expressed in each of them. As we observed the silver anniversary of Friends of Nursing back in 2013, we began devoting time to documenting the stories of some of the most influential leaders within Duke Nursing. Remembering these early leaders is both humbling and energizing. We surely stand on the shoulders of giants. In 2015, we highlighted the careers of Wilma Manier and Inez Turk-James. Last year, we focused on the contributions of Mary Ann Peter and Norma Harris. And this year, we are honoring Janet Clapp and Evelyn Morgan. Unfortunately, neither Janet or Evelyn could be here with us this evening. Janet Clapp graduated from the Charlotte Memorial Hospital School of Nursing in 1951 and first worked on the Meyer Psychiatric Unit at Duke University Hospital. There she met Jim Clapp, a UNC medical student at the time, whom she later married. At UNC, Janet was a nurse on a general medicine unit and then in a urology clinic. And in the late 1950s, Jim's training took them to Dallas, where he completed an internship and residency, followed by a postdoctoral research fellowship and a stint with the U.S. Public Health Service. In 1963, Duke recruited Jim to be an associate professor in the Division of Nephrology. Jim and Janet raised 2 sons, Bobby and Tommy, and Janet returned to her nursing career at Duke when the boys were older. She worked on the GYN unit and in various other roles for about 15 years, and she said she most enjoyed working the night shift. Late in her career, she worked in the Duke Center for Living for the Duke Executive Health Program, for which Jim was the founding director. Both Jim and Janet retired in 2001, and they reside in Durham, and the Janet H. Clapp Award for Excellence in Nursing Practice was first presented in 2002. Evelyn Morgan holds 2 degrees from the Duke University School of Nursing, a BSN in 1947 and a master's in 1972. She began her nursing career at Duke in 1953 as a staff nurse, then became head nurse of the Minot Ward in 1968, and then later head nurse on Jordan Ward. Evelyn was Duke's first oncology nurse clinician. She had a vision for what oncology nursing should be and helped to develop the program at Duke in the 1970s. She opened the first oncology unit at Duke. She was instrumental in planning for the construction and the RN staffing for the Morris Cancer Research Building, which opened in 1978. Evelyn was a respected nursing leader who mentored many nurses and residents to improve the quality of care for oncology patients at Duke. She retired in 1988 and now lives in Lilburn, Georgia. The earliest documented presentation of the Evelyn Morgan Award for Excellence in Oncology Nursing is 1993. Please take time this evening to enjoy the displays in the foyer that highlight these remarkable Duke nurses. And if you had the privilege of knowing or working alongside Janet or Evelyn, I hope that you will share some of your personal memories of them with your colleagues. And if you choose, in a note that you can send along, you'll find their addresses on the legacy table. We will continue to feature remarkable Duke nurses each year for the foreseeable future. And as you came in this evening, I hope you noticed the Remembering Duke Nurses tribute in the foyer. If not, please take time on your way out to note the names of the Duke nurses who have passed away since this event last year. The Gala Committee created the tribute in honor of the contributions of these former colleagues. And although every death among us is impactful, I want us to especially remember our 3 Lifelight colleagues who we tragically lost on September 8th, along with a patient, in a Duke Lifelight helicopter crash. Because nurses Chris Harrison and Crystal Solinger and pilot Jeff Burke died in the line of duty, I pay special tribute to them this evening. And Friends of Nursing will be working in the future to develop an appropriate program to honor the Lifelight crew members who we lost. So at this time, would you please join me to observe a moment of silence in honor of all of our nurses, friends, and family who we've lost this past year. Thank you. This gala provides us an amazing opportunity for honoring exceptional Duke nurses, like these 36 seated here on the stage. In addition to soliciting nominations for these awards, Friends of Nursing also facilitates nominations for community and professional awards year-round. During the last fiscal year, more than 100 Duke nurses were nominated for awards. Beginning on page 29 of your program is a list of individual nurses and teams that have received honors and awards this past year for their extraordinary professional practice. We are very proud of all Duke nurses who have been recognized this year for their professional practice. If you are in the audience, please stand and let's recognize you now. All of the nurses who received awards this past year, including the winners here on stage, have one thing in common. Someone took the time to nominate them for an award, to tell the story of their nursing excellence. I know that it takes time to write a nomination, and I know how challenging it can be to get nurses to talk about what makes them special, because nurses will tell you that they're just doing their job and that they want to recognize another colleague or their team. But when you take pen to paper or fingers to keyboard to put the details into a nomination, the impact can be far-reaching. To be nominated for an award is a great honor, and nominations positively impact how they view themselves and care providers and colleagues. So I think it is very important to recognize the 213 nurses who were nominated for the 2017 Excellence Awards. And so if you're here tonight, please stand. Thank you for your commitment to Duke University Health System and to nursing excellence. The names of all 213 nominees are listed on page 18 of your program. This evening, the nominees have special name badges with royal blue nominee ribbons attached. Please take time after the award ceremony to congratulate the nominees and to thank them for their exemplary practice. As we continue celebrating the past, present, and future of Friends of Nursing, I also want to recognize all the nurses who have received Excellence Awards since 1989. The names of 688 previous winners are on pages 19 through 23 of your program. And if any of our prior winners are here, would you please stand and be recognized? So some of the past winners are wearing nominee ribbons because a Duke nurse can be nominated for Excellence Awards multiple times. However, winning a Friends of Nursing Award is a once-in-a-lifetime honor. To all of our past winners, thank you for your continued commitment to Duke Nursing and to care excellence. During the award ceremony this evening, other nurse leaders will be involved with award presentations, and we'll introduce each other along the way. As in the past, we have special presenters for several of the awards whom will join us on the stage. We will recognize each of the 36 award winners individually. The comments we present about each, as well as the narratives that are printed in your program, are excerpts from their original nominations. These stories will give you a sense of the incredible impact that these nurses have had on the lives of their patients, the families of their patients, and their colleagues. After we introduce each award winner, the recipient will meet the presenters at center stage to receive a Friends of Nursing pin, an engraved trophy, and a certificate. In addition, each winner will receive a $1,000 education stipend from Friends of Nursing. At this time, I'd like to invite Doctors Mary Ann and Jess Peter to join me on the stage for the first award presentation of the 2017 Gala. The first award is the Mary Ann and Robert H. Peter Award for Excellence in Nursing Practice as a Registered Nurse. Mary Ann and Jess graciously established this award in 1996.
The 2017 award is presented to Emily Bowen, a clinical lead on general medicine, Unit 8100 at Duke University Hospital. 4 colleagues nominated this winner. 1 wrote, "Emily is one of the most exceptional nurses I have ever worked with. She is highly effective, a member of our team, and invests herself in the hospital, the unit, and in each of the individuals who work our unit. This Duke nurse is a leader in patient care through her active participation at all levels in our shared governance, where she works to advance the practice of nursing. She regularly attends clinical practice council, where she presents ideas and information from the unit to initiate discussion on current nursing practice and policy issues so there can be thoughtful discussion around appropriate practice. Emily, please come forward and receive your award.
The second award to be presented is the Wilma Manier Award for Excellence in Nursing Mentorship. Wilma Manier was the Executive Director of Nursing Services for Duke University Hospital from 1970 until her retirement in 1984. As a mentor to many of Duke Hospital's administrators and nursing leaders, Wilma is remembered as a tenacious advocate for patients and nurses and a strong leader who earned the respect of all who worked with her. The 2017 Wilma Manier Award for Excellence in Nursing Mentorship is presented to Jan Fortman, the nurse manager for aesthetic services in the private diagnostic clinic. Jan received 6 nominations. According to one, I first met this nurse in 2016 as part of a mentorship pilot when I joined the PDC team. This veteran welcomed me and my numerous questions. She met with me and another newly appointed clinical lead. She listened and answered multiple questions, provided resources, and showed us how to navigate the PDC. She responded to our emails and phone requests when we had questions. Her nurse manager knowledge and clinical experience expedited my own onboarding within the PDC. Jan is truly dedicated to the development of our future leaders. Jan, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. Before we move on to the next award, I would like to take a moment to also recognize Domie Austria, who won the 2016 Manier Award, but was in the Philippines at the time of the gala last year, celebrating his parents' 50th wedding anniversary. Dome, could you please stand and let's give you a round of applause. I'd now like to invite Tracy Goslin to the podium to preside over the next 6 award presentations. Tracy is the Chief Nursing and Patient Care Services Officer for Duke University Hospital.
Good evening, and thank you, Marianne. Our next award is the Excellence Award in Nursing Education. This award is presented to Mary Beth Gallo, a diabetes nurse clinician with Duke Specialty Rehab Services Midtown, a department of Duke Raleigh Hospital. Mary Beth was nominated by a colleague who wrote, "This nominee has been a nurse for more than 40 years and a certified diabetes educator since 1993. She has made diabetes education her life's work and says it is a calling for her. She effectively blends her technical competence of how to administer insulin with the why in a straightforward, positive, you can do this manner. Her patience to gently guide stressed or frustrated patients towards a better understanding of this chronic disease is legendary. Her warm and caring presence helps patients to realize that they can make adjustments and that even small steps can be beneficial to their health. Mary Beth, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. acknowledge the Turk James family. With us this year are Fran James, Norman James, and Terry Namargat, and Jerry Turberville. I believe that Fran, Norman, and Terry will be assisting with the presentation of the Endowed Award in their mother's name. Turk James was a dedicated registered nurse at Duke Hospital who became our first ostomy nurse clinician. She inspired Dan and Martha Blaylock to establish Friends of Nursing and was honored with an Excellence Award at the first gala in 1989. In 1990, an Endowed Award was established in her honor.
This year's recipient of the Inez Turk James Award for Excellence in Nursing Practice is Stephanie Yates. Stephanie is a nurse practitioner in the Center for Advanced Practice at Duke University Hospital. 3 colleagues nominated this winner. One wrote, "Stephanie provides clear, patient-centered, and family-focused communication. She definitely embodies a motto of my grandmother always spoke to, always have 2 ears and 1 mouth. She listens intently to her patients and families. She anticipates their needs, which leads to a very successful trajectory of care for each patient. The nurse, this nurse has most definitely gone above and beyond. During a snowstorm, she drove to a patient's home to assist her with securing an ostomy pouch. For Stephanie, this call for help was bigger than any snowstorm, and she successfully helped the patient to keep a pouch on throughout the severe weather. Stephanie, we thank you and honor your excellence in the practice of nursing. Please come forward to accept your award."
The Heart Center Award for Excellence in Cardiovascular Nursing in recognition of Mary Ann Peter. The 2017 award winner is Anna Turner, a clinical nurse 3 on the cardiothoracic step-down unit, 3300 at Duke University Hospital. A colleague nominated this winner, writing, "She consistently changes her schedule on the weekends. She has altered her schedule on numerous times to meet the needs of the unit. She is a preceptor because she works on a lot of off shifts. She frequently is called upon to manage emergency situations, security issues, customer service issues, and is a clinical resource to the nursing staff and multidisciplinary team. She is seen as a role model and mentor. She receives favorable comments from the orientees she mentors or precepts. They want to emulate her bedside manner, efficiency, and her clinical expertise for patients. Anna, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." I would like to invite Sharon and Richard Dooley to join me on stage to present the next award. Sharon is a member of the Friends of Nursing Advisory Board. Sharon and her husband, Richard, established the Edward and Florence O'Keefe Friends of Nursing Endowment Fund in 1994 in memory of Sharon's parents. The Edward and Florence O'Keefe Award for Excellence in Oncology Practice is presented to Danielle Rhea, a clinical nurse 4 in the Radiation Oncology Clinic at the Duke Cancer Center. 6 colleagues nominated Danielle. A radiation oncologist wrote, "Over the years, I've come to rely heavily on her in a number of ways. First, she is clinically superb. Our patients often develop radiation-induced skin reactions that can range from mild to severe. This nurse is highly capable in her management, so much so that I often have patients come back immediately after treatment and follow up with her until their symptoms improve. I'm available as needed, but for the most part, she cleans, assesses, dresses, and manages their wound care independently. In fact, she and another nurse utilized this experience to develop a protocol, assess its impact, and presented their results at a national meeting. Danielle, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. I will now present the 2017 Medtronic Physio Control Award for Excellence in Emergency Trauma Nursing. On behalf of Suzanne Hale, our representative from Physio Control, Suzette regrets that she could not be with us this year. The Medtronic Physio Control endowed this award in 2003. The 2017 winner is Nicole Volker, a clinical nurse, too, in the emergency department at Duke University Hospital. A colleague nominated this emergency nurse, writing, "She is highly respected by her peers, emergency medicine providers, and coworkers from other departments. She is the co-chair of the emergency department's Critical Care, Trauma, Nursing, Clinical Practice Committee. She has a tremendous role in preparing the organization for the 2018 American College of Surgeons visit to reaccredit the hospital as a designated Level 1 trauma center. The national standards are all about achieving consistent practice to quickly identify injuries, regain physiological homeostasis, and prevent predictable complications in the trauma patient. Nicole is teaching computer classes about documenting in real time in the electronic health record, evaluating documentation, and providing this feedback to her colleagues in emergency services. Nicole, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. The next award is the Terry L. Johnson Award for Excellence in Pediatric Nursing, which is funded by an endowment that Donna Johnson established in 2004 in memory of her late husband. The 2017 recipient of the Johnson Award is Kimberly Davis, a clinical nurse 4 and family education champion in the intensive care nursery at Duke University Hospital. A colleague nominated Kimberly, writing, "An active advocate of developmental care, which can help sick or premature babies grow and get better. She has promoted kangaroo care, week with her parents, taught classes to new graduates, and equipped parents with the skills they need to care for their baby in the neonatal intensive care unit. With the nominee's encouragement, parents in the NICU can assist nurses with assessments and no longer fear that they are harming their child, but feel assured that they are assisting in the overall outcome of a thriving baby outside of the NICU. The nominee knows that this is one of the interventions that promotes optimal neurobehavioral development of the infant. Kimberly, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. welcome Cheryl Brewer to the podium. Cheryl is the Associate Vice President for Nursing for the Private Diagnostic Clinic and a Clinical Associate at the Duke University School of Nursing. She will preside over the next 5 award presentations.
Thank you, Tracy, and good evening, everybody. The Award for Excellence in Nursing Practice for an LPN is presented to LaDonna Dotson, a medical licensed practical nurse with Duke Children's Specialty Clinic of Raleigh, part of the Private Diagnostic Clinic. 3 colleagues nominated LaDonna. One wrote, "She is one of the key nurses in our allergy and pulmonary clinic. One day, we had a patient who had received an allergy shot and left the clinic. Shortly, the patient's sibling called and reported that the patient was having shortness of breath. She quickly jumped into action, met the family out front with a wheelchair, brought the patient upstairs, and immediately helped to stabilize the patient. She took charge of the situation and maintained communication with the providers during the whole encounter. She kept the family informed and got the patient a movie to keep him calm during this recovery." LaDonna, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. Our next presentation is the Nurse Research Mentor Award. This year's recipient is Kimberly Denty, the Associate Vice President for Accreditation, Patient Safety, and Clinical Site Development for the Private Diagnostic Clinic. Kimberly received 2 nominations, with more than a dozen colleagues contributing to 1. According to the collaborative nomination, she developed a framework to assist employees in developing performance improvement projects using 6 Sigma processes. Specifically, Kim spearheaded the use of a data-driven quality strategy, DMAIC, for define, measure, analyze, improve, and control, inviting various nurses to adopt new ideas while stretching their comfort zone. Projects included sample drug usage, fall prevention, patient identification. She coached staff to assimilate the project aims and findings into shareable presentations. Each project, noted, had posters accepted at various local and national quality conferences. The Falls Prevention Project won our health system's 2017 Patient Safety Award. Kimberly, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. The Nan and Hugh Coleman Friends of Nursing Endowment Fund supports 2 awards. I will present the first of the Coleman Awards on behalf of Hugh Coleman, who could not be with us this evening. The recipient of the first Nan and Hugh Coleman Heart Center Award for Excellence in Nursing Practice is Kimberly Mangum, a nurse clinician who cares for patients at our Duke Cardiology of South Point Clinic, part of the Private Diagnostic Clinic. A colleague nominated Kimberly, writing, "She is selfless and dedicated. She supports her physicians, advanced practice providers, fellow nurse clinicians, and patients with professionalism every day. She is at the top of her scope of practice and is a resource to all. She does not hesitate to share her knowledge when others need assistance. She is equally valuable to all of the members of the team, and she makes all of the members of the team feel valued. She did all these things while completing her BSN and having major surgery this year. If we could duplicate her, it would be a great thing for Duke." Kimberly, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. Would Ben Tim and Galen Tim please join me on the stage to present the Ernestine Davis and Edward L. Cole Awards. Thank you to Jean and Mary Jane Cole and to Ellen and Richard Tim for supporting these awards. Ben will announce the first Cole Award.
This year's Ernestine Davis and Edward L. Cole Award for Excellence in Nursing, Excellence in Medical Intensive Care Unit Nursing is presented to Kim McLeod Estes, a clinical nurse 3 on Medical Intensive Care Unit 6 East at Duke University Hospital. This ICU nurse was nominated by a colleague who wrote, "She always has a positive attitude, whether she is in charge, orienting a new nurse, or providing clinical care. She never seems to let the small things bother her and always responds to requests, whether they are from families, patients, or peers, with the utmost professionalism. She is a great preceptor and often a go-to person for ideas and strategies to assist new preceptors. She has great ideas and tips and always approaches situations with a positive perspective instead of starting with a negative insight. She looks for ways for the teams to succeed. Kim, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award."
The Ernestine Davis and Edward L. Cole Award for Excellence in Coronary Care Unit is presented to Dustin Targ, a clinical nurse 3 on Cardiac Intensive Care Unit 7700 at Duke University Hospital. A colleague nominated this ICU nurse writing, "He is there not only for the patient, but for the family as well. He encourages them to vent concerns, be present on rounds, and he shows his compassion daily. His care is second to none." I walked by his room where he was caring for a critically ill patient. Even though he was very busy, the patient was neat, clean, and looked like he was having a peaceful nap. I stood back and thought, this is what the family sees. Dustin is an overall awesome nurse. If anyone deserves a Friends of Nursing Award, he does. Dustin, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award.
Vicki Orto will now come to the podium to preside over the next 6 award presentations. And I invite Dr. Earl Ranson to join her on the stage. Vicki is the Chief Nursing and Patient Care Services Officer for Duke Regional Hospital. Earl is the President of the medical staff at Duke Regional Hospital.
Thanks to the generosity of physicians at Duke Regional Hospital, each year we present 6 medical staff awards for excellence in nursing practice to Duke Regional nurses. We are very grateful for our physicians for supporting these awards. The first Duke Regional Hospital Medical Staff Award for excellence in nursing practice is presented to Deborah Brooks, a clinical nurse
A clinical nurse 2 on medical dialysis unit 5-1 at Duke Regional Hospital. A colleague nominated Deborah, writing, "I have never worked with a nurse like her who can radiate comfort, compassion, empathy, and competence by her mere presence at the bedside. She is emotionally present. Patients and their families can sense this, feel this, and it just wows them. Who would not want a nurse who conveys to you that she is available to you without exception? She will be helping you to endure this together. She is willing to listen and understand your feelings and your fears and help you go through this stage in your life by supporting you to the very best of her abilities." Deborah, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. Medical Staff Award is presented to Samantha Fan, a clinical nurse 2, who also works on 5-1 at Duke Regional Hospital. A colleague nominated this winner, writing, "Samantha exemplifies our health system's values in each of her roles as a charge nurse, a preceptor, and committee member. As a Duke Moves champion, she went above and beyond her duties. She did more than educate our unit. She coordinated the education of the entire medicine service line, which is 4 units. We learned more than just how to use the proper lift equipment. We were taught proper body mechanics, bed functions that assist with turning, bed alarm fixtures, and the policies in place for our units. She did role-playing and included information about the room environment and safety concerns that could arise. Samantha, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." Award is presented to Heather Hackler, a clinical nurse 4 in the emergency department at Duke Regional Hospital. A colleague nominated this winner, writing, "This charge nurse efficiently runs the emergency department, ensuring that at least 170 patients are seen quickly each day. She jumps in and helps triage patients, and it is evident that she cares about the people in our community. Recently, she was caring for an elderly patient who was having difficulty feeding himself. She sat down and fed him, and his face lit up. She said he reminded her of her papa, and she would want someone to do this for him. She is compassionate and remembers that it is the little things that make a difference in the lives of our patients. Heather, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." Medical Staff Award is presented to Brett Winters Jordan, a clinical nurse 3 with emergency services at Duke Regional Hospital. A colleague nominated Brett, writing recently, "When caring for a patient with chest pain who was brought to her room from triage, she noted that the patient stated the pain had changed. The tech had just completed an EKG per protocol and it was fine. However, because this nurse's keen assessment skills and astute clinical judgment, she knew they needed to repeat the EKG. The second EKG indicated an acute ST segment elevation, indicating the patient was having a myocardial infarction. Her skillful assessment enabled the quick activation of the cardiac cath lab for catheterization, and the patient had great outcomes. Brett, we thank you and honor you for your excellence in the practice of nursing. Brett could not be with us this evening as she is on her honeymoon in Thailand. I'm sure she's watching by the live stream, though. Accepting the award on Brett's behalf is her colleague, Beth Johnson Barr, who is a health unit coordinator. Here. All right, yay. The next Medical Staff Award is presented to Evelyn McPherson. A clinical nurse 3 on Medicine Dialysis Unit 5-1 at Duke Regional Hospital. 3 colleagues nominated this nurse, writing, "This candidate is an excellent leader and role model. With over 17 years of experience, she exudes expertise and intelligence. She is a trusted resource, serving as a charge nurse on a regular basis and precepting new staff and prospective charge nurses. As a charge nurse, she is most effective by drawing out positive qualities from each person and encouraging them to function at the same level that she does, which is how she elevates care. She encourages the staff to work together as a team and creates an environment that is conducive to achieving the highest levels of trust and camaraderie. Evelyn, we thank you and honor you in the excellence in the practice of nursing. Please come forward to receive your award." The last Medical Staff Award for 2017 is presented to Anna Nishimwe, a clinical nurse 2 in the intensive care unit at Duke Regional Hospital. A colleague nominated this ICU nurse, writing, "My nominee is caring, detail-oriented, empathetic, and accountable for her decisions. She goes the extra mile to ensure the physical needs as well as the emotional and spiritual needs of her patients and families are met. She cares for the whole patient. I have never known her to express a negative thought or emotion on the unit. She will always put the needs of her patients and peers first. She is the nurse I want to be when I am in staffing, and the nurse I want caring for my family member when they are critically ill. My nominee is the best nurse we should all strive to be." Anna, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. We're going to pause from the award presentations to enjoy an inspirational slideshow featuring Duke nurses from throughout our health system. Many thanks to those who submitted photographs for this presentation, and especially to Wanda Bride, who coordinated this project. When we continue with the award presentation, Sue Ganser will be the presenter. Sue is the Director of Nursing Practice for Duke Home Care and Hospice. Please enjoy the slideshow.
I can't say that everything's okay, 'cause I can see the tears you're crying, and I can't promise to take the pain away. But you can know I won't stop trying. I'll be the angel by your side. I will get you through the night. I'll be the strength you can't provide on your own. 'Cause when you're down and out of time, and you think you've lost the fight, let me be the angel by your side. I know it feels like you're running out of faith, 'cause it's so hard to keep believing. Oh, but if I can bring a smile back to your face for a moment, you'll forget all about it. Oh, I'll be the angel by your side. I will get you through the night. I'll be the strength you can't provide on your own. 'Cause when you're down and out of time, and you think you've lost the fight, let me be the angel by your side. 'Cause this won't be the last time you'll need a little hope. But I wanna be the first to let you know I'll be the angel by your side. I will get you through the night. I'll be the strength you can't provide on your own. 'Cause when you're down and out of time, and you think you've lost the fight, well, let me be the angel by your side. Oh, let me be the angel by your
Each year, we present the Drew Award to recognize excellence in hospice nursing practice. The Drew Award is supported by an endowment that Gail Lane established in 2004 in memory of her husband, Richard Drew. The 2017 recipient of the Drew Award is Maya Jackson, a clinical nurse 2 with Duke Home Hospice. A colleague nominated this nurse, writing, "She recently worked with a patient experiencing breathing difficulties that were limiting his ability to enjoy his favorite activities. Together, they formulated a plan that included medication management and non-pharmacological interventions, which allowed him to spend time outside each day, interacting with neighbors and visitors who came by his front porch. This was a wonderful example of looking at the total picture to achieve the best possible quality of life. Maya truly has exemplified the best of hospice over her career spent working to ensure an extraordinary patient and family experience for all we care at the end of life. Maya, we thank you and honor your excellence in nursing practice. And Maya is unable to be here this evening, and I am accepting the award on Maya's behalf. Established by the Durham County Hospital Corporation Board of Trustees funds 2 awards. The first Board of Trustees Award for Excellence in Nursing Practice is presented to Zachary Cochran, a clinical lead with emergency services at Duke Regional Hospital. A colleague nominated Zachary, writing, "This nurse is instrumental in the management and continued development of our clinical decision unit and our emergency department. He has worked closely with the medical director of the CDU to manage patient care. He has attended workshops that have enhanced his knowledge and promoted some out-of-the-box ideas that have been implemented. Currently, CDU usage has increased by 16% as he has simplified admission processes. His continued diligence to managing this unit has decreased the length of stay for our observation patients, thus improving overall patient satisfaction. Zachary, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." The second Trustees Award for Excellence in Nursing Practice is presented to Sammy Everling, a clinical nurse 3 on Medical Surgical Dialysis Unit 5-1 at Duke Regional Hospital. 2 colleagues nominated this winner, and one wrote, "When I asked her what motivated her to become a skincare champion, she said it was something that she was passionate about. She is an expert resource for wounds, pressure ulcers, wound vacs, dressing orders, and the documentation of assessment findings. She helps staff understand the importance of repositioning patients and documenting accordingly. Our unit is a diaper-free environment, and she has been instrumental in ensuring that our patient's skin is kept clean and dry. Her strong work ethic and support of the Skin Care Champions Committee has helped our unit and Duke Regional Hospital exceed expectations of 0 acquired pressure ulcers." Sammy, that's great. Sammy, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. The Duke Regional Hospital Auxiliary Organization established an endowment that supports an annual award. The 2017 Auxiliary Award for Excellence in Nursing Practice is presented to Linda Martin, a clinical nurse 4 on Neurology Oncology Unit 5-3 at Duke Regional Hospital. A colleague submitted the nomination, writing, "This nurse proactively pulls patients from the emergency department in collaboration with patient flow. Her ability as a leader and charge nurse enables quick decompression of the emergency department, which means the expectations of our patients and their loved ones to quickly transition to inpatient rooms for comfort and care. This is such a demonstration of compassion and understanding, coupled with leadership that moves a team in a collective direction. By role modeling these leadership behaviors and mentoring others, this nurse has successfully accommodated the movement of 10 to 12 patients in a shift on many occasions." Linda, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. invite Barb Matthews to the podium to preside over the next award presentations. Barbara is the Associate Chief Nursing Officer for the Population Health Management Office for our health system.
The next award is for Excellence in Women's Health Nursing. This award is presented to Agnes Ali Osman, a clinical nurse 2 in the Duke Birthing Center at Duke University Hospital. This labor and delivery nurse, with 49 years of nursing experience, received 20 nominations. A colleague said, "I wonder if our youngsters realize what a treasure they associate with in the trenches of the Duke Birthing Center. Do they know she loves unconditionally? Do they know her travels and studies bring gifts money can't buy? Do they know she carries holy anointed oil, in her scrub jacket every night?" And quoting George Eliot, our dearest Agnes, "A friend is one to whom one may pour out all the contents of one's heart, chaff and grain together, knowing that the gentlest of hands will take and sift it, keep what is worth keeping, and with the breath of kindness, blow the rest away." We love you, Agnes Ali Osman. Agnes, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. Representing Monica Watson for the presentation of the 2017 Watson Family Award for Excellence in Patient and Family Education. This award is supported by the Donald R. and Monica C. Watson Friends of Nursing Endowment, which they established in 1993. The 2017 recipient is Greg Flynn, a clinical lead on the Cardiothoracic Intensive Care Unit 7 West at Duke University Hospital. A colleague nominated this winner, writing, "Greg is an outstanding clinician who works the night shift. He is highly skilled and knowledgeable, thoughtful in his care delivery, and sensitive to the needs of patients and their families. One night, he supported a new nurse who received an unstable transplant patient from the operating room. Greg was in the patient's room with the primary nurse throughout the shift, helping her perform tasks, explaining rationales for interventions, and communicating with the family. He maintained a calm environment and was able to teach the novice nurse valuable critical thinking skills and how to prioritize tasks during difficult situations. Greg, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." The next award for Excellence in Critical Care Nursing. This year's recipient is Larissa Thompson, a clinical nurse 4 of the Intensive Care Unit at Duke Regional Hospital. 2 colleagues nominated Larissa. According to one, this nurse has been instrumental in starting 2 programs that have had a great impact on patient outcomes at Duke Regional Hospital: the Early Intervention Team and the Mock Code Blue Committee. Through her work, she has impacted patient outcomes, improved response times, educated bedside nurses, improved the workflow in the ICU, and overall impacted patient safety in a positive and lasting way. She is a leader not only in the ICU, but throughout our hospital. Her constant dedication to improving patient outcomes also gained her recognition. In May, Larissa won the Duke University President's Award. Larissa, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award.
representing Hugh Coleman for the presentation of the second Nan and Hugh Coleman Heart Center Award for the Excellence in Nursing Practice. The award goes to Laura Spack, a clinical nurse 3 on the cardiothoracic step-down unit 3300 at Duke University Hospital. A colleague nominated this nurse, writing, "Laura is one of the hardest working nurses I know. I remember a time she cared for a very sick and challenging patient who was confused, very weak, and hypertensive. She spent a large amount of her time getting to know the patient and family. Unfortunately, the patient did not make it. However, Laura handled that situation amazingly. The care and support that she provided the family afterwards was more than they had ever expected. The spouse of the patient expressed to me that they would always remember her and the positive impact she made on their lives. Laura, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." My colleague, Priscilla Ramsier, will continue with the award presentations. Priscilla is the Chief Nursing and Patient Care Services Officer at Duke Raleigh Hospital.
Good evening, and thank you, Barbara. The nurse selected to receive the 2017 Award for Excellence in Perioperative Nursing is Whitney Tahiri, a clinical nurse 3 in surgical services at Duke Raleigh Hospital. A colleague nominated this OR nurse, writing, "According to her colleagues, she uses her problem-solving skills each day in the operating room to alleviate delays for first cases, as well as turnovers, to ensure the doctors know if there's an issue that needs attention before it becomes a problem, and to help her coworkers." As an example, when this nurse realizes the preference card is not correct for the CPT code, the current procedure terminology code, listed by the physicians, she works with the case pullers, adding resources to the case list and removing unnecessary items to ensure everything needed for the procedure is readily available. Whitney, we thank you and we honor your excellence in the practice of nursing. Please come forward to receive your award. This year, I have the honor of representing the Maddox family for the next award presentation. The 2017 Myra Smith Maddox Award for Excellence in Medical Surgical Nursing is presented to Kristen Merritt, the Director of Neuroscience Service Line at Duke Raleigh Hospital. A colleague nominated Kristen, writing, "This colleague exemplifies excellence. She fosters positive interprofessional collaboration by being inclusive of team members and by leading committees and the hospital initiatives. She helped implement an early progressive mobility program that improved patient outcomes and had a significant favorable financial impact of $1.2 million for the organization. This program has continued to fuel her desire in patient safety and clinical quality. The program's success has received local, national, and international recognition, including the President's keynote address at the 2014 American Association of Critical Care Nurses Conference, a podium presentation at the AACN National Teaching Institute Gathering, WRAL TV, and Forbes magazine. Kristen, we thank you and we honor your excellence in the practice of nursing. Please come forward to receive your award. I'd now like to ask Elizabeth Land of Hill-Rom to join me on the stage. Hill-Rom has generously established 3 endowments for excellence awards, enabling us to recognize 3 exemplary nurses. The Hill-Rom Award for Excellence in Nursing Practice at Duke Raleigh Hospital is presented to Joanne Carey, a clinical nurse 4 in the Progressive Care Unit. A colleague nominated Joanne writing, "This nurse is expert at initiating projects and designing processes. She created a reference manual to help colleagues study for certification, and she mentors and encourages others along the way. Her acumen for mathematics, organization, and technology are a core to her nursing practice. She has developed registries, established workflows, and created tracking systems for patient cases, physician volumes, and infections. These activities speak of her integrity and honesty. She ensures accountability by setting up transparent systems for managing information about healthcare practices and patient outcomes. Joanne, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." The Hill-Rom for Excellence in Nursing Practice at Duke Regional Hospital is presented to Doreen Kenealet, a case manager on Rehabilitation Unit 7300. A colleague nominated Doreen writing, "When a patient with spinal cord injury was due for discharge home, some of the treatment team members recommended a home visit. Despite having a full caseload of patients, she immediately volunteered to go." An occupational therapist notes, "This nurse actively participated in the initial home visit and helped problem solve various situations. She went back a second time when it was evident that the patient needed additional assistance. She spent the afternoon visiting the patient and assisting with organizing and cleaning to ensure there would be space for a required medical equipment and supplies, and an adequate area for daily care needs. Doreen, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." The third Huron Award for Excellence in Nursing Practice is presented to Gigi Thomas, an ambulatory care lead nurse at Duke Asthma, Allergy, and Airway Center, which is part of the private diagnostics clinic. 5 people were involved in nominating this winner. A patient wrote, "Gigi has been my main primary nurse for several years. I live out of state, and I have come to her clinic for a chronic condition. She plans my appointments with me and ensures that my visits will be as smooth as possible once I am in the clinic. I often see this nurse role modeling the behavior that she said is required of all of her nurses. I would have never made it without this nurse. She is the true wind beneath my wings, and I can soar as high as I need as long as she continues to be on my side. Gigi, we thank you and we honor your excellence in the practice of nursing. Please come forward to receive this award." Thank you, Liz. I am honored to present the Evelyn Morgan Award for Excellence in Oncology Nursing Practice. The 2017 winner is Susan Bruce, a clinical nurse specialist at Duke Cancer Center, Raleigh. A colleague nominated this winner, saying, "Susan has been actively engaged in oncology nursing for 4 decades, bringing an energy and passion to defining and improving nursing care. Even in a brief interaction, she emanates enthusiasm for oncology nursing. The ideas flow, possibilities emerge, and the solutions are sought. Patients express gratitude for her positivism and her knowledge. She has made a difference in improving certification rates from 10% to 65%. It is incalculable the number of staff she has helped through her professional and volunteer activities and mentorship, hallway advice, 55 presentations, 34 published articles, numerous posters, and thousands of one-to-ones with patients and families. Susan, we thank you and we honor your excellence in the practice of nursing. Please come forward to receive your award. And now, I will return the podium to Mary Ann.
At this time, I have the pleasure of representing Janet H. Clapp and Dr. James Clapp, who were not able to be here this evening. The Janet H. Clapp Award for Excellence in Nursing Practice is supported by the Clapp family and is given to an exceptional registered nurse in honor of Janet. The 2017 Janet H. Clapp Award for Excellence in Nursing Practice is presented to Abby Beekner, a clinical nurse 2 on Neuroscience Step-Down Unit 4100 at Duke University Hospital. 2 colleagues nominated Abby. One wrote, "She has championed hourly rounding, not just for herself, not just for our unit, but hospital-wide. She has taken this concept and run with it. She found it not only improved her day greatly, but also how patients perceive their care. She has coached our unit staff to adopt this way of caring for our patients, which has helped create better workflows and improved patient satisfaction scores. She has done a great job that other units have invited her to their staff meetings to teach the concepts of purposeful rounding." Abby, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award. At this time, I invite Clifford Harris to the stage. Clifford is the brother of Norma Harris, for which our next award is named. Norma was a much-loved nurse who began her 40-year nursing career at Duke University Hospital in 1959. When she retired in 1999, she had served in numerous positions at Duke and had received a host of awards from across the country. In October of 2000, her friends and colleagues honored her by creating an endowed award in her name.
Thank you, Mary Ann. On behalf of the Harris family, I'd like to thank the Friends of Nursing for inviting me to present this award. The Norma L. Harris Award for Excellence in Nursing Practice is presented to Caitlin Taylor, a clinical nurse 2 on General Medicine Unit 4300 at Duke University Hospital. A colleague nominated this nurse, writing, Caitlin took the lead in the wedding of one of our patients, exactly how the patient wanted. She borrowed a wedding dress from friends for the patient to choose from. She coordinated food, decorations, set up and clean up, and helped the couple obtain a marriage license, which was a challenge due to the out-of-state residency and lack of documentation that North Carolina would accept. Caitlin called surrounding counties and learned that Granville County would accept the documents they had on hand. The couple secured the license, which was important to them as they wanted the wedding to be official and not just ceremonial. Caitlin, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award.
We'll end the award ceremony with the presentation of the 2017 Award for Excellence in Nursing Leadership. This award is presented to Kay Lytle, who serves as Chief Nursing Information Officer for our health system and is a clinical associate in the Duke University School of Nursing. Kay's nomination included 8 letters of support, and a colleague wrote, "Kay is a strong nursing leader within our health system. She is present and visible. Kay has worked to ensure frontline staff members have a more active voice in Maestro care and how to make it better for all, especially the patient. She has engaged a broad team from across our system to take a hard look at what we document and how it relates to policy and practice. Kay understands that it is critical for the leader to hear and understand the challenges faced by the end user. She is a strong advocate for all of Duke Nursing and has led the charge to have IT support nursing rather than nursing adapt to the IT platform. Kay is that current leader who brings skills, talent, and vision to create a better today and position nursing for a stronger tomorrow. Kay, we thank you and honor your excellence in the practice of nursing. Please come forward to receive your award." Ladies and gentlemen, please join me in congratulating the 2017 Friends of Nursing Excellence Award winners. And I would ask for one more round of applause, please, for all the nurses who are back at our hospitals caring for our patients, and especially those who traded shifts so that colleagues could attend the gala. So our celebration continues with a buffet dinner. The convention center staff will guide guests from each table. Please wait for your table to be called, and it goes quickly, I promise. So following dinner, you are welcome to stay in this ballroom to visit and enjoy dessert, or you can celebrate on the dance floor next door. Our photographer, Ken Huth, will remain for at least another hour for professional photographs, which we'll make available to you. So please see Ken to capture memories of the 2017 Friends of Nursing Gala. And please check the back cover of your souvenir program. If you have a star on your program, the flower arrangement in the center of your table is yours to take and enjoy. Thank you and good night.
Thank you, Thank you all for being here tonight. If you would, please follow. I'm going to be announcing tables for everyone to go to dinner. Everyone will be exiting through these doors. Table number 4, 5, and 6, if you would, please head toward the brown doors on this side of the room. Tables